and elementary student immunization requirements. I have Representative Hayes and Representative Jackson with me. We have 15 minutes because that's the way this session is going, and so I'm giving everybody a minute to talk, just in case every single person in the room would like to say something so that we can hear from you. Please come to the microphone, turn on your microphone, identify yourself, and we will time you. Thank you. Hello, my name is Heather Ryan. I am with the organization Bitches Get Stuff Done. We are registered in opposition to this bill. This is the third anti-vaccination bill we've spoken on in the past 2 days. And the last time we spoke on an anti-vaccination bill, Senator Salmon said that it was because the Fourth Amendment makes it so you can't have unlawful search and seizure on a body. I found that to be a ridiculous argument when we are having people stolen off the streets and we don't even have reproductive freedom in control of our own bodies. So I wish that we would stop as a state and a legislative body being so anti-science. Vaccinations are proven to keep the community healthy, and these are just right to infect bills. I highly oppose any time that you try to put it into parents' minds and the public's minds that these are not safe. If these are safe, they are proven effective, and I urge you to stop being so pro-anti-vax and anti-science. Thank you.
Hi, good afternoon. I'm Jamie Cashman with the Iowa State Association of Counties, and we're registered opposed to this bill because of the potential risk to public health this would place in Iowa, the Iowa counties by removing this requirement. Thank you.
My name is Jane Kolchak. I'm a private citizen, but I'm the director of the Iowa Department of Public Health and a member of the Centers for Disease Control COVID-19 vaccine response team. And I'm here in opposition to this bill. I would like to submit a statement if I can. Briefly, the time I don't want to take up your time, but I think we need to understand here that the science is very clear and settled on this. Childhood immunization practices are one of the most thoroughly studied medical interventions in history. They've been used for decades with hundreds of millions of doses administered worldwide. The vaccine evidence shows that they are safe, they're highly effective. There are absolutely no credible evidence linking their use to autism or other developmental disorders. And the question's been studied repeatedly, exhaustively, and conclusively with both the medical and the public health communities are unified on this point. I urge you to vote against this bill and to help support the vaccination children that are going to submit more time.
Chair, members of the committee, my name is Oliver Bardwell, Violence for Freedom. HF 270-2171 is simple in principle. It restores parental authority and ends the practice of conditioning access to education on compliance with medical procedures. This bill does not ban vaccines. It does not interfere with medical care. It simply says that families, not government agencies, should make health care decisions for their children without being threatened with school exclusion. Over the last few years, many Iowa families watched recommended become mandated. And mandates become barriers to education, careers, and clinical training. That erosion of trust matters. When government uses schools as enforcement tools, you create resistance instead of confidence. Education should be accessible to every child. Parents should not have to choose between their convictions and their child's school life. HF 2171 draws a clear line. Medical decisions belong in the family and in the doctor's office, not in enrollment offices.
Thank you.
Thank you.
Hello, Seth Brown on behalf of the Iowa Medical Society and the Iowa chapter of the American Academy of Pediatrics. IMS represents about 6,000 physicians, medical students across the state, and the pediatricians as well. We are registered against the bill. We expect this bill to have pretty significant impacts on Iowa's already strained healthcare workforce. We do have concerns about some of the follow-on effects and unintended consequences that could come from this. These immunizations take very little time on the front end and very little effort. And then the diseases that they prevent on the back end can hospitalize patients for significant periods of time. And so when we fear that hindering some of these preventative disease protections will result in increased emergency room admissions, further straining the workforce, and occupying a finite number of beds. So we do have concerns about how that will impact access to care for other patients that need those beds as well. We would also note that there are currently exemptions in place, and so we would just encourage those folks in that direction.
Hello, I'm Jessica Hyland with the Iowa Biotechnology Association. We are also registered opposed to the legislation. As Seth mentioned, there are exemptions in the code already, and we think that those are avenues that are available now, and that this goes too far in the direction of not encouraging folks to have vaccines. So we oppose the legislation. Thank you.
My name is Bree Johnson. I am speaking on behalf of Informed Choice Iowa. Parents are the legally recognized medical decision makers for their children, not the state and not school administrators. Education is a fundamental opportunity for Iowa children, and tying it to medical compliance is unethical. Schools are tasked with educating children, not enforcing medical compliance. These decisions belong in a doctor's office between parents and their child's physician. Administrators and school boards should not interpret exemptions, arbitrate health decisions, or police families. This bill removes schools from a role that they were never meant to occupy. From a public health perspective, risk is not uniform. Children have vastly different medical histories, immune responses, and risk profiles. And due to complex chronic health conditions that are plaguing our children, healthcare models are moving towards individual-based care, which one-size-fits-all mandates for school attendance obviously contradicts. Coercion breeds resistance, while respectful dialogue increases engagement, patient buy-in, and accountability. Therefore, tying vaccine compliance to school is increasing hesitancy, not reducing it. Thank you.
Hi there, Jamie Yates, Plain Children's Hospital. We're registered in opposition to the bill. Appreciate the fact you have a difficult decision, right? You have to, as a legislature, you have to be able to balance the needs and rights of an individual, as well as you're responsible for public health. So I think our pediatricians at Blank are this is like the bill that scares them the most about children's health. And I don't think I'm being dramatic about that. We, in our lifetime, have probably never experienced one of the basic childhood immunization outbreaks. Blank was founded as a response to the polio epidemic. And before we had vaccines, we know that 10,000 children every year were paralyzed by polio. Measles, an estimated 4 million children were infected, killing 500 children. Rubella caused birth defects and mental delays in 20,000 newborns. I urge you not to move this bill forward.
Thank you.
Thank you.
Hi, Lindsay Maher, resident of Pleasant Hill, former virologist. Wanted to just also speak to the science of this, but also the fact that in 2022, the Iowa poll was asked Iowa residents whether or not they felt that Iowa still needed to have a vaccine school schedule, and only 34% of Iowans believed that. That was down from 59% in 2015, and I would say largely due to the impacts of public health outreach on the pandemic. So 34% of Iowans are the only ones who believe we need to continue to mandate vaccines for school entry. The CDC recently removed 6 shots off of universal recommendation for all children due to the lack of evidence that all children need these. Meningococcal and hepatitis B were 2 of those vaccines that are on our school schedule. Additionally, there are countries around the world who do not have vaccine schedules required for schools, and they have a 90% compliance rate with the recommended vaccines. This is because vaccine coercion, thank you, yes.
Hi, Claire Lewis. I'm here on behalf of Iowa Public Health. I have with me Lena, who will defer our comments too, but we are registered.
Thank you. Lena Tucker-Reinders. I'm the Executive Director of Iowa Public Health Association. I am here in opposition to the bill, as are all of my medical and health colleagues here in the room today. This bill, if passed, would endanger Iowans and set a dangerous precedent for our country. We know that many states are looking at us right now for an example. Vaccines are one of the most important protections we can offer our children and our communities. School vaccine requirements actually encourage parents to speak with their providers about their children's health, and in fact, maybe the only touch point they have, or the only reason for a touch point they have with their healthcare provider in the state. They do not infringe on the right of any child to receive any quality education, medical, and no cost or no contest religious exemptions already exist and are accessible to parents. And in fact, school-required vaccines, meaning that most of the children in the classroom, which is a high-density environment where diseases and viruses spread quickly, those vaccines, the fact that all the other children are vaccinated, actually protect those who are not vaccinated, either by choice or by medical contraindication. So this bill is very important for Iowans.
Good afternoon, Representatives. Teresa Harms. I'm here representing a couple of different clients, the Brain Injury Association, Every Step, who's a visiting nurse services organization, and then Easter Seals. And so just wanted to let you know they're opposed to the bill, and mostly repealing this immunization requirements puts vulnerable kids with compromised immune systems at risk of serious illness and death. Dropping these mandates requires that the health of the kids with these chronic conditions who rely on herd immunity, which is what you heard about already. And then by eliminating these requirements, we're abandoning our most fragile kids, including those with rare genetic disorders, to fight disease alone. So just understanding that that herd immunity is such an important component, especially in their school buildings. Thank you.
Thank you. With that, I'm going to let the committee speak so that we can get out of the room. Whoever's next.
Thank you, Madam Chair. Thanks to everyone who came and spoke on this bill. Is Representative Deacon here by any chance, since it's his bill? Okay. I will have to ask him at another time then. I do find it curious that the bill still requires it for child care facilities, but not for elementary and secondary ed. And I just find that confusing because to me, public health is public health, and I don't know why we would have different requirements. That being said, I'm strongly opposed to this bill. It is one of the most dangerous pieces of legislation I've seen come through this building in a number of years. I think it's important to recognize that Iowa has had these requirements since 1977, and prior to that, Iowa also had the highest per capita incidence of both measles and mumps in the country. Public health matters. This bill is dangerous for our kids, and I don't know why we would be telling families in Iowa that we do not value public health or making sure that their kids are healthy. Since we're short on time, I'll keep it at that. But I will strongly discourage this subcommittee from moving the bill forward, and if it does move forward, then I will be making more extensive comments in committee later today.
Thank you very much, Representative Bowden. A couple of comments from me. She just left. I was going to just tell our friends to get things done that I really do appreciate Senator Salmon over there in the Senate. She has been a fabulous advocate for children and women for more than a decade now. And so if Sandy ever listens to this, thank you, Sandy. Regarding the science settled, I think maybe that deserves a little bit more conversation. There's a reason why the CDC went from 17 to 11 childhood vaccines. Why is that? I wouldn't exactly say the science is settled. If by voluntary immunization, 90%, if that's an accurate number, 90%, that's pretty significant. If the community that loves choice, can you have a choice to go to school? They would argue, yes, if you fill out a religious exemption. But can you still go without necessarily doing a religious exemption? What if you weren't religious? I think that's a pretty significant number. So I thank you all for coming. I appreciate hearing what you have to say on this. I don't know that I agree with it being so fear-based and fear-mongering that terrible, terrible things are going to happen if we don't demand that people get their children vaccinated. they have that choice. Thank you.
Thank you, everybody, for being here. I do intend to move the bill forward. I think it deserves more than just three of us to weigh in on it. I do look at a 1977 immunization schedule, changing significantly from that time period into many vaccinations that we were required to get in order to attend school. Thankfully, the legislature has taken the time to create a few exemptions, but it still doesn't just give parents choice. And to Lena's comment, you either really have to have a medical concern or you have to claim that you're religious. And I think that's coercing parents into a situation in which they're not able to utilize their parental right, find the right vaccination schedule for their child. I mean, we're not saying that kids aren't going to get vaccinated. There's many parents that now graduate into how quickly they will do that while working with their pediatricians and doctors. And so I think it's just a different time period where we need to start considering a more robust conversation. Education is important. Educate the parents, and but don't force them into a forceful vaccination schedule. So I think there's some middle ground. I think there's some conversation to be had, and I just like to move the bill forward so we can talk about it. Thank you.